Every man believes he knows what positions women love, but most are completely wrong. And I don't say this to provoke, but to open an honest conversation. I'm Dr. Mariana, a specialist in sexual health and intimacy with over 30 years of experience helping couples reconnect and rebuild trust in their most intimate moments. Throughout my career, I have heard thousands of versions of the same story. Men who try hard, men who sincerely love, but men who end up wondering why she seems distant or distracted just when they should be closest. And almost always, the answer isn't found in passion, it's found in physiology. How the female body actually responds, what she truly needs to feel comfortable, safe, and above all, fully alive. In this video, we won't talk about tricks or cinematic fantasies. We will talk about human science, practical anatomy, and deep respect. I will explain the 5 positions that women truly enjoy, not because they're fashionable, but because they better suit their bodies. I'll also discuss 2 very popular positions that often cause discomfort in practice. But most importantly, you will learn why certain approaches work. By adjusting angles, rhythm, and contact, you can create an experience that is natural and mutually satisfying. If you stay until the end, you will understand a simple principle that transforms any relationship. True intimacy is not about doing more. It's about feeling better. It's about reading the body's signals and responding with intelligence and care. Before we dive into specific positions, there is a simple truth that will change the way you understand intimacy forever. Most men, even the most attentive and loving ones, believe that female pleasure depends on the same things that give them pleasure: rhythm, depth, intensity. But a woman's body doesn't work that way. Her pleasure is based on 2 pillars that must always be present at the same time. First, steady and comfortable blood flow to the pelvic tissue. Second, reliable external stimulation right at the front of the pelvis while internal movement occurs. That combination of flow and contact is what allows the brain to receive the correct signal. Without it, even if there is genuine affection or strong desire, the sensation disperses. It dilutes. It never builds to anything meaningful. For years, expert-reviewed studies in sexual medicine have confirmed something that surprises many men. Only a small minority of women achieve climax solely through internal movement. Most need or prefer simultaneous external stimulation because that is where the greatest concentration of nerve endings exists. That's why when a man relies only on depth or speed without maintaining frontal contact, he may feel confused afterward. He thinks he's not doing enough when in reality he's doing too much of the wrong thing. I have seen couples married for 20, 30, and even 40 years completely rediscover their connection with just a small adjustment. Reducing the range of movement. Maintaining constant forward pressure. Nothing more complicated than that. The female body responds to the rhythm of stability, not haste. This is fundamental to understand. And here comes another point that many forget entirely: the importance of relaxing the nervous system. When a woman is tense, anxious, or forced to adapt to an uncomfortable angle, her brain interprets the sensation as something to control and manage, not something to enjoy and surrender to. But when she feels safe, when the body receives gentle contact, something beautiful happens. The parasympathetic system activates, circulation improves naturally, and the sensation flows without resistance. That's why the favorite positions among women are not the most flashy or acrobatic. They're the ones that allow easy contact at the front, gentle angles, and freedom to move without strain or effort. This understanding will be our map for the rest of this video. We won't seek perfect positions. We'll explore smart adaptations that respect physiology and prioritize comfort for both partners. This position seems simple, almost too everyday to top any list. But in clinical practice, it is one of the most effective and beloved by couples seeking comfort, connection, and duration. Lying on your side reduces muscle effort significantly. It protects the joints, which is especially important for people over 60, and it allows constant closeness without losing eye contact or physical affection. From a medical perspective, this posture keeps the pelvis parallel, creating a smooth, sliding internal angle. This anatomical detail is crucial. It prevents deep thrusts that can cause discomfort and facilitates precise pressure control. Additionally, it allows one hand to remain free at the front, helping to maintain the external stimulation I mentioned earlier. Here's my practical advice for this position. Place a small pillow or a folded towel between the knees. This aligns the hips properly and prevents pelvic rotation that can cause lower back tension. Keep the movement short and rhythmic, almost like a gentle sway. The key is not in strength, but in maintaining contact between the base of your pelvis and the front of her body. When that contact is sustained, the sensation multiplies, and the female body responds without the need for speed. Many couples find that this position becomes even more pleasurable if they alternate between short movements and a gentle sway of the hips. There's no rush. The secret is to stay there breathing together rather than constantly seeking depth. This position is as intimate as it is practical. One person sits on a firm surface, such as the edge of the bed or a stable chair, while the other settles on their lap facing them. Direct eye contact stimulates the release of oxytocin, the bonding and trust hormone. Chest-to-chest contact helps synchronize breathing and reduces muscle tension, promoting steady blood flow throughout the body. In this angle, the pelvis of the person sitting remains fixed, while the partner on top can control the rhythm and depth completely. This stability turns friction into a rocking motion, maintaining constant pressure on the front of the pelvis, exactly where most women feel the greatest pleasure. Think about rolling and pressing, not pushing and pulling. Keep the pelvis base in full contact. If you want to vary the intensity, simply tilt the torso slightly backward or forward to change the angle without losing alignment. Both hands are free. One can maintain balance and the other can provide external stimulation. Additionally, this position is excellent for older adults or those with limited mobility. It requires no significant strength or flexibility and can be maintained for longer without fatigue. Some call it the most traditional position, but when done with attention and knowledge, it becomes one of the most profound in emotional and physical connection. Body to body, breathing in the same rhythm. The ability to read microexpressions on the face. In sexual medicine, this is considered a factor of neuronal synchronization. When a couple can read signals of pleasure or discomfort in real time, the nervous system adapts and the body responds better. From a clinical perspective, face-to-face positioning maintains a neutral penetration angle that can be optimized by placing a small pillow under the hips of the receiving partner. This tilts the pelvis, aligning the inner surface with the area of greatest sensitivity at the front. Shorten the range of motion and apply gentle pressure forward at the end of each movement. This constant pressure prevents the sensation from being interrupted. Continuous frontal contact maintains the simultaneous stimulation that most women need. If you want more intensity without increasing depth, do not use more force. Change the angle with a folded towel. Small adjustments create big results. This position also promotes nonverbal communication, caressing, kissing, eye contact. All of these activate brain regions associated with pleasure and calm, and a relaxed body feels more. This is the position of conscious control and is probably the most underestimated by many men. Here, she sets the angle, the rhythm, and the depth. She can adapt at any moment, adjust her posture, and direct the sensation to where she feels it best. This not only increases her pleasure, but also reduces the risk of discomfort or pain, which is essential at any age. In large clinical surveys, most women describe how they deliberately change the angle of their hips to keep the sensation right at the front of the pelvis. This position allows doing so naturally, effortlessly, and freely. Forget rapid vertical movements. Think of circular or gentle swinging motions, keeping the pelvis pressed against your partner's pelvis. This way, external contact remains constant and blood flow is not interrupted. If the knees get tired, there are safe variations. She can support herself with her hands on her partner's chest or advance one knee to reduce muscular effort. She can also partially support herself on a pillow behind. This position also has a powerful emotional benefit. The feeling of autonomy and control increases confidence and connection because it eliminates the fear of discomfort. And when the body feels free, pleasure flows naturally. This position, often misunderstood, generates mixed opinions in surveys. Some women find it too intense, while others describe it as one of the most pleasurable. The difference lies entirely in the adjustments of angle, rhythm, and contact. When done without attention, it can feel too deep or impersonal. But when performed with proper alignment, it becomes one of the most complete experiences. The secret is in the tilt. If the person receiving slightly brings their knees together and rotates their hips slightly forward, the internal angle changes. Instead of direct pressure toward the back, the friction falls on the inner front surface where the tissue is more sensitive. Place a pillow under the hips to accurately adjust the angle. Use slow sliding movements. Do not push hard. Keep one hand steady at the front to ensure constant external contact. And most importantly, communicate. Ask, look, feel. Confidence does not interrupt the moment, it deepens it. In recent studies, couples who apply these adjustments report a significant increase in pleasure and emotional connection, especially when the movement remains gentle with pauses and shared breathing. All these positions share something essential. They do not seek performance, they seek alignment. They focus not on strength, but on preserving frontal contact and maintaining constant blood flow. That is what science confirms. That is what thousands of couples discover when they stop trying to impress and start listening to their bodies. In my consultations, the same question always arises. Doctor, what about the positions seen in movies? Are they really as good as they seem? The answer is clear. Not always. Some look spectacular, but physiologically they are unsustainable or even counterproductive. In theory, it seems romantic, spontaneous, passionate. In practice, it is a physical challenge that the female body rarely enjoys. The slippery floor reduces movement control, muscles tense to prevent falls, water removes natural lubrication, making the tissue more sensitive and potentially causing small irritations. Additionally, the internal angle is almost always too vertical, creating unnatural pressure. The result is discomfort, tension, and a complete loss of frontal stimulation. If the idea of a water environment appeals to you, simply move out of the direct flow of water. Use a stable surface like the edge of the bathtub, where both can support themselves. This restores balance and allows for proper contact without forcing postures. Very popular on the internet, but almost always problematic in real life, especially for women over 45 years old. This position requires extreme flexibility in the hips and lower back. It causes tension in the pelvic ligaments and can compress nerves in the lower back. The entry angle is often too direct, putting pressure on sensitive areas. What appears on screen as depth often feels like pain in the body. To achieve a similar feeling of openness without causing tension, place a firm pillow under the tailbone. This reduces leg flexion and softens the internal angle. Movements should be short, slow, and accompanied by breathing. Both positions show the same error pattern. They prioritize form over feeling, which is the opposite of what conscious intimacy seeks. In clinical practice, there is no single ideal position. What women and mature couples enjoy most is not a specific posture, but a condition: the ability to adjust the angle and maintain frontal contact effortlessly. True pleasure arises from the personalized adjustment that each couple creates together. When I observe couples who have regained their connection, I notice a clear pattern. They do not focus on technique. They focus on listening. They have learned to read small gestures, a quickened breath, a slight hip movement, a barely audible sound, and they respond attentively without breaking the rhythm. That ability to read the other person's body is a form of emotional wisdom. Breathing. When she begins to breathe more deeply or sigh rhythmically, the body is aligned with the sensation. If she holds her breath, it's a sign of tension. Slow down, change the angle, or get closer. Stillness. Often, the most intense moment is not in movement but in pause. When both remain still for a few seconds, the brain interprets that stillness as safety. Tension decreases and the sensation expands. Learn to hold those silences. Muscle tone. A relaxed body feels warm and receptive. A tense body is protecting itself. If you notice resistance, don't insist. Adjust your posture. Support one hand. Speak calmly. Talking during the encounter is not a weakness. It is a sign of maturity. A simple phrase like, "Is this okay?" or "Do you want me to stay like this?" can open a huge door to trust. Mature intimacy is not about discovering new positions every night. It's about rediscovering the same person with greater understanding. Sometimes a small change is enough. A higher hip, a shorter movement, a firmer hand, so that the body can once again feel at home. The thread that connects everything is not a technique nor a hidden secret. It is a simple principle: stable comfort at the front of the pelvis, an adjustable internal angle, movement that maintains the sensation. In sexual medicine, we often say that pleasure is an advanced form of communication. It's not about performing, it's about understanding, letting the body speak and responding with attention. Mature love does not seek to impress, it seeks to understand. After 60, the body changes, but sensitivity does not disappear. It simply needs new conditions to express itself. Every muscle, every breath, and every pause can become a bridge between two people who choose each other with respect. I'm Dr. Mariana, and my wish is that this knowledge serves you not only to improve your intimacy, but to experience it with more serenity, empathy, and science on your side. If this video helped you see things more clearly, share it with someone who also wants to learn how to care for connection with kindness and curiosity. Because true intimate health does not start in the body. It starts in the way we choose to look at, touch, and listen to each other. And remember, age does not extinguish desire. It refines it, deepens it, and transforms it into something far more valuable than what we had in our youth. Wisdom wrapped in tenderness, connection built on decades of trust, and pleasure that no longer needs to prove anything because it simply exists between two people who have chosen to stay present with each other through every season of life. Thank you for being here with me today. I'm Dr. Mariana, and I'll see you in the next one.